perform hand hygiene outside of the patient's room for 20 to 30 seconds vigorously or until dry. Taking note of precautions, no noted precautions, so we can enter the patient's room. Knock, knock, knock. Hi, good afternoon. My name is Wendy. I'll be your student nurse today, and I'll be performing an assessment with you. Could you please let me see your armband and tell me your name and date of birth?
Alex Hamilton, date of birth is January 11th of 1990.
Perfect. And any allergies?
Yes, aspirin.
Okay. And what's the reaction?
I usually break out in hives and a rash.
Okay. All right. Perfect. Thank you. So what brings you in today?
I'm having a headache and some ringing in my ears.
Okay. Have you had this in the past?
No.
Okay. And is there anything that you notice that brings this on?
Maybe my allergies, I would say.
Okay. Anything you notice that makes it better?
No.
Okay. And how would you describe that?
I would say that it's a pretty consistent issue.
Okay. And would you rate that mild, moderate, or severe?
Moderate.
Okay. And then on a level of 0 to 10, 0 being no issues, no pain, 10 being the worst that you've experienced, how would you rate that on the scale?
I would say it's about a 2.
Okay. And when did this begin?
2 days ago.
Okay. And have you done any treatment for it at home?
Just rest.
Okay. And any past surgeries?
No.
Okay. And Miss Alex, you've already told me who you are and the reason why you're here. Do you know where you're at receiving care?
Yes, Bearcat Regional Hospital.
Perfect. And what is today's date?
October the 3rd of 2024.
Perfect. Patient is noted to be alert and oriented ×4. Patient appears to be well nourished. Patient appears to be well groomed. And also, patient is sitting erect and no noted deformities. Okay, so Miss Alex, how do you feel today?
I'm feeling okay.
And is that how you usually feel?
Yeah, it's pretty much.
Okay. Patient's mood and affect match are appropriate, and patient's speech is well articulated. Okay. Alrighty. So Miss Alex, we're going to start with your assessment. We're going to start with your head. Okay. So I'll just do a few exercises with you, and I'll tell you everything along the way. Okay. All right. Patient's head appears to be midline in proportion to shoulders. So first, I'm just going to be touching your head and inspecting it. Anything I should know about?
No.
Okay, perfect. Inspecting. And do you feel any tenderness with the touch?
No.
Okay, perfect. Patient's cranium is noted to be normal cephalic, no noted lesions, and patient does not express any tenderness. Hair is equally distributed as well. All right, Miss Alex, so we're going to do a little exercise. I'll just have you do a few exercises with your mouth. If you can smile, okay? If you can frown, okay? If you can raise your eyebrows, and you can relax them, and close your eyes, and then open them, and then close your eyes, and I'll be pulling against it. Keep them closed, okay? Patient's cranial nerve 7 is noted to be intact, okay? And then Miss Alex, for your eyes, okay? We're gonna go on to your eyes now. Patient's eyelids do not appear, wait, do you wear any glasses, Miss Alex?
No.
Okay, perfect, thank you. Now, patient's eyelids have no noted redness, swelling, or ptosis, and eyelashes are equally distributed, okay? So now I'm just gonna be checking your inside of your eye. I'm just gonna pull down and I'll have you look up.
Okay.
Okay. Patient's sclera is noted to be white bilaterally, and conjunctiva is pink bilaterally, okay? And patient's eye gaze is midline and no noted protruding. And then Miss Alex, we're just gonna do an exercise where you look at my nose and I bring in the light into your eyes, and I'm just monitoring your pupils, okay? Okay, and if you can look at that picture behind me, okay, and then like my nose, okay. Pupils are equal and reacted to light and accommodations. Pupils are equally rounded and reacted to light and accommodations, sorry. Okay, so now the next exercise, I'll have you follow the pin light and just follow in the direction I go without moving your head. Perfect. Cranial nerve 3, 4, and 6 are noted to be intact. Okay. So now, Miss Alex, do you wear any hearing aids?
No.
Okay. Any issues?
No.
Before I touch? Okay. I'm going to touch your ears. Just let me know if you have any tenderness, okay? Inspecting the front, the back. Any tenderness?
No.
Okay, just looking inside. Okay, same on this side. Any tenderness?
No.
Okay, just checking the inside, front and back. Patient's ears, left and right, appear to have no deformities out to the outer or inner, and patient does not complain of any tenderness. Okay. All right. And now, Miss Alex, your nose. Okay, I'll take a look at your nose. And you just take a look up. Perfect. No outer abnormalities noted. No inner abnormalities noted, and septum is midline. No noted deviation. Okay, and I'm just going to inspect 3 of your sinuses, your frontal, maxillary, and ethmoid. Okay, and whenever I do this, I'll ask if there's any tenderness. Okay, across the eyebrows, do you have any tenderness?
No.
Okay, across her cheekbones, do you have any noted tenderness?
No.
Okay, behind the nose, any noted tenderness?
No.
Okay, patient does not express any tenderness to frontal, maxillary, or ethmoid sinuses. Okay. Okay, now we're going to be going to your mouth, okay? So if you can just smile for me. Okay, patient's lips are noted to be midline. Patient's lips are noted to be pink, no cracking, and no noted deformities. Okay, so have a pin light. Okay, so now I'm just going to be having you open up and saying all, okay?
Okay.
You can take your tongue out. Okay, perfect. Patient's inner mouth, the buccal mucosa is noted to be pink, hard and soft palate in place, and uvula is in midline, and tonsils grading is a 1. Okay, and then Miss Alex, if you can stick your tongue out and then go side to side and then say light, tight, dynamite.
Light, tight, dynamite.
Okay, cranial nerve 11 is noted to be intact. Okay, and then I'm going to be checking your throat, Miss Alex. Okay, so if I can just have you tilt back a little bit. Okay, and I'm just going to touch real quick. Okay, patient's trachea is noted to be center and midline, and I'm just going to palpate. Okay, any tenderness? Okay, no swelling and no noted tenderness from patient, and we're going to check 10 of your lymph nodes. Okay, first is preauricular in front of your ear. Any tenderness?
No.
Post-auricular behind the ear. Any noted tenderness?
No.
Occipital further back. Any noted tenderness?
No.
Okay. The jugular-digastric. Any noted tenderness?
No.
Okay. The submandibular. Any noted tenderness?
No.
Okay. The submental. Any noted tenderness?
No.
Okay. The superficial cervical. Any tenderness?
No.
Okay. The deep chain cervical. Any tenderness?
No.
The posterior cervical. Any tenderness?
No.
Okay. And the supraclavicular. Any tenderness?
No.
Okay. Patient does not express any tenderness to the lymph node areas. Okay. Miss Alex, so the next one, we're going to have you shrug your shoulders up, drop them down, left to right, your head movements. Perfect. So I'm going to have you go against resistance. I'm going to try to push your shoulders down. Don't let me do it, okay? Lift. Perfect. And if you can look that way, against resistance, push. Okay. And now this way, against resistance, push. Okay. Cranial nerve 11 is noted to be intact. Okay. And then we're going to be checking your skin. Okay. So what I'll have you do is just stick both your upper arms out. Okay. Patient's skin appears to be appropriate for ethnicity. No noted redness, jaundice, or cyanosis. Okay. And I'm just going to be checking your temperature to both upper extremities. Patient's upper extremities are noted to be cool to touch. No noted moisture. Texture to both upper extremities appear to be smooth. And we're just going to be checking for your any edema in the bony areas. Okay. No noted edema to both upper extremities, and I'm just going to take a slight pinch and just check your skin turgor. Skin turgor is adequate, no noted signs of dehydration. And if I can see your fingernails, fingernails have adequate blood return, no issues noted. Shape, color, contour, and consistency are adequate in both left and right hands. All right, so Miss Alex, I'm going to be moving down to your lower extremities. Okay, just doing the same, checking the temperature to both extremities. Both lower extremities are cool to touch, no noted moisture, and skin texture is smooth. And just checking along the shins in both areas down to the ankles. No noted edema to both lower extremities. And if I can see your toenails, Miss Alex, okay. The shape, color, contour, and consistency to both left and right feet are appropriate and adequate. No noted deformities. Okay. So Miss Alex, now we've done your head, ears, eyes, nose, throat, and skin assessment. I do appreciate you for your cooperation and your time. Is there anything I can do for you?
No.
Okay. So I will be making sure your bed is in the lowest position. Making sure your wheels are locked. And they are. I'm going to be lifting your side rails. Both side rails are up. And here is your call light. This is what you use to call me in case you need anything. I will be back within the hour. Thank you.